Hello, this is ESNEFT Deteriorating Patient Nurses here with a short presentation highlighting changes that have occurred within the flow sheets of Epic and how to document if a patient has refused to have their vital signs recorded. The flow sheet now has a new row at the bottom labelled Refused OBS. There is a drop-down menu available by clicking on the magnifying glass within this row, where we can document which observations the patient has refused. This could be blood pressure, heart rate, temperature, or SpO2. Let me show you how this works. First, enter all the vitals that the patient has consented to. Should they decline any of the vital signs, then use the new row to document this, clicking on the vitals which they have declined. The next rows, which will cascade below, will depend on which vitals they have declined, but the question will be based on your clinical intuition. If the patient has declined and you have clinical concern that the patient is deteriorating or refusing because they're unwell, then you would click on the clinical concern +3 option. This is highlighted with a red arrow on your screen. If you have no clinical concern, the patient looks well and the rest of the vitals are stable, then you would click on no clinical concern +0 option. This is highlighted on your screen with a green arrow. Your choice affects the total news score. If you choose that they have declined, but you are concerned, this adds a 3 to the total news. If you have marked they have declined, but you are not concerned, then this adds in a 0 towards their total news. In this example, the patient has a news of 10, as seen in the blue square on your screen. Escalation of this news of 10 will follow the news policy. In this example, the patient has refused to have their blood pressure and temperature done. I've left these areas blank on the flow sheet. I've then recorded this in the refused OBS row. This is highlighted with a green arrow on your screen. I'm concerned about their blood pressure and feel that the patient might have a low blood pressure as they are tachycardic and that the patient is showing other signs of hemodynamic compromise. Therefore, I have recorded clinical concern for the BP. This is the red arrow on your screen. I'm not concerned about the temperature, so I've recorded this as no clinical concern. You can see this as a blue arrow on your screen. The clinical concern for the BP adds in a 3 to the total news, and therefore the total news is 10 for this patient. The total news will not show until you have filed the vitals. Let's look at another example. If we look at the vitals saved in the last column, this is highlighted with an orange arrow. We can see that the patient has refused to have their heart rate taken, so I've left this blank. This is highlighted in the green circle. I have no clinical concern that this patient is unwell, and therefore I have recorded this as no clinical concern, as seen next to the blue arrow. This is a 0 towards their total news. The patient has no other vital signs that are outside of the normal range, therefore this gives a total of 0, as highlighted in the red circle. The timer for the next set of observations will be guided by this news score. In the emergency department, the principle remains the same. Document which vital has been declined, then state if you're concerned that the patient is refusing because they are unwell or not. You can record the refusal of observations in your Vital Signs tab on the ED Narrator, as seen in the red box on your screen. The example on the right shows that the patient has refused their blood pressure. There is clinical concern, and therefore the total is 18, which includes the 3 for the refused blood pressure. There is one more important point to add in this training video. In order for us to recognise deterioration and to keep our patients safe, we need to ensure that we are recording a full set of vital signs. A new score will be produced once all of the required documentation is entered. This includes the temperature, the heart rate, the oxygen saturations, the oxygen therapy, and if they are on oxygen, we need to record the flow rate or the FiO2, the patient's blood pressure, the respiratory rate, and the patient's AVPU. If you miss any of these elements, Epic still allows you to save the vitals, but your patient will not have a new score calculated. As a result, they will not be highlighted as needing escalation, and the timer will not be reset. The patient example in the yellow box on your screen does not have a full news completed. The element missed out was the documentation of whether the patient was on air or oxygen. This is titled oxygen therapy. Without this information, a news score cannot be produced. This patient should have had a news of 10, but no one can see this due to the missing element. There are two important things that you can do to overcome this problem. Number 1, always check the total has calculated after you have filed your news. If it hasn't, go back and put in the missing element. Number 2, if you need help understanding which elements are required to produce a score, there is a button at the top of your flowsheets tab titled Required Documentation. This is a traffic light symbol. If you click on this, it will highlight the rows that are required. The flowsheet on your right of your screen in the green box has highlighted in red the required documentation to make a new score. So to summarise, if a patient declines their observations, record on your vital signs flowsheet or ED narrator. If you have no clinical concern, then this scores 0 to the total news. If you are concerned, this scores 3 for each parameter you are concerned about. The timer will reset once a new news is produced. It is an important aspect of patient safety that we are recording a full set of news each time. Check you have your news total on your patients. Any questions, please contact your line manager or the deteriorating patient team. Thank you.